This topic is on maxillary nerve. The maxillary division of the trigeminal nerve arises from the middle of the trigeminal ganglion and it's purely sensory in function. The maxillary nerve leaves the cranium through the foramen rotundum. Once outside the cranium, the maxillary nerve crosses the uppermost part of the pterygopalatine fossa between the pterygoid plates of the sphenoid bone and the palatine bone. It gives branches to the sphenopalatine ganglion, the posterior superior alveolar nerve, and the zygomatic branches. So within the orbit, it occupies the infraorbital groove and becomes the infraorbital nerve, which courses anterior to the infraorbital canal. The maxillary division emerges on the anterior surface of the face through the infraorbital foramen, where it divides into its terminal branches, supplying the skin of the face, nose, lower eyelid, and upper lip. So this is a summary of maxillary division in skin. It supplies the middle portion of the face, the lower eyelid, the side of the nose, upper lip, mucous membrane of nasopharynx, maxillary sinus, soft palate, tonsil, and hard palate. It also supplies the maxillary teeth and the periodontal tissue. The maxillary division gives off branches in four regions: within the cranium, the pterygopalatine fossa, the infraorbital canal, and on the face. Within the cranium, it gives off a small branch called as middle meningeal nerve, which travels with the middle meningeal artery to provide sensory innervation to the duromata. We have branches in the pterygopalatine fossa, the zygomatic nerve, the pterygopalatine nerve, and the PSA nerve. The zygomatic nerve all divides into zygomatico-temporal and zygomatico-facial. Just before leaving the orbit, the zygomatic nerve sends a branch that communicates with the lacrimal nerve of the ophthalmic division. The branches of the pterygopalatine nerve includes orbital branch, nasal branch, branch to palate, and the pharynx. The nasopalatine nerve continues downward, reaching the floor of the nasal cavity and giving branches to the anterior part of the nasal septum and floor of the nose. The greater palatine nerve descends through the pterygopalatine canal, emerging on the hard palate through the greater palatine foramen. The pharyngeal branch is a small nerve that leaves the posterior part of the pterygopalatine ganglion, passes through the pharyngeal canal, and is distributed to the mucous membrane of the nasal part of the pharynx posterior to the auditory tube. The PSA nerve descends from the main trunk of the maxillary division. It provides sensory innervation to the buccal gingiva in the maxillary molar region and adjacent facial mucosal structure. Continuing downward, this second branch of PSA nerve provides sensory innervation to the alveoli, periodontal ligament, and pulpal tissues of the maxillary third, second, and first molar. Branches in the infraorbital canal. The MSA provides sensory innervation to the two maxillary molars, periodontal tissues, buccal soft tissue, and bone in the premolar region. So in branches of face, you have infraorbital nerve, inferior palpebral branches, external nasal branches, and superior labial branches. This is a summary. Within the cranium, it gives middle meningeal nerve. In the pterygoid palatine fossa, it gives zygomatic nerve, which in turn divide into zygomatico-temporal and zygomatico-facial. Pterygopalatine nerves, you have orbital branches, nasal branches, palatine branches, and pharyngeal branch, and posterior superior alveolar nerve. Branches within the infraorbital canal, we have middle superior alveolar and anterior superior alveolar. Branches on face, we have inferior palpebral, external nasal, and superior labial branches. Thank you.